So, good morning. Today I'm going to discuss with you one article that I read about sexual dysfunction after mid-urethral sling surgery. So, mid-urethral sling surgeries are done for stress urinary incontinence. As you know, stress incontinence happens when the patient is unable to control the sphincter, when the social situations are not favorable for bladder emptying. So, it's such an annoying thing to the women. So in previous days it happened to be to the ladies beyond 60 to 70 years, but now because of the early onset diabetes and all, this thing incontinence is happening at an early stage. So it is essential that we are aware of the kind of surgery done for this procedure. So we have two kinds of sling surgeries, that is transvaginal and the transobturator. See, transvaginal is otherwise the retropubic sling. So you can see the mesh passing behind the pubis, passing behind the urethra, and then the support is made in front of the pubic symphysis. Whereas a transobturator is like passing via the obturator foramen of one side, fixing back to the urethra, and bringing back of the obturator foramen of the other side and tightening. So what is the disadvantage of this transobturator method is because it passes via these main important point where the dorsal clitoral nerve is commencing. It can pressurize over the nerve, and it can impair the nerve sensations. So when the sensation is lost, the women will lose the sexual experience and there will be no secretion. So no sensation, no secretions, so no orgasm. So definitely the sexual function is going to be get impaired because of the transobturator tape. Also because we are using a foreign tape, the for any foreign body is going for allergy and reactions. So erosion can happen and it can land up in failure. So it is important that we assess the sexual function of the women before and after the procedure. So we have a score called as FSFI, that is Female Sexual Function Index. It includes 6 parameters: the desire, arousal, lubrication, orgasm, satisfaction and pain. Each score will be given some 6 points and total will be added. It can range up to range from 2 to 36, and we assess. So before surgery evaluation score, after surgery evaluation score, we can compare. So this is the advantage and disadvantage of TOT that we have known. Transvaginal tape is because of its difficulty in access and its involvement in blocking the blood supply to the clitoral artery. It is not used nowadays. Only transobturator tape is used because of its ease of access. So this TOT has got so many uh, disadvantages as we discussed now. So why is surgery needed for SOI? A simple cystocele, does it need to be corrected? No. So when a patient is having cystocele, you have to send it to a urologist. They do a dynamic urodynamic study and they measure all the values, and depending upon the values only they determine whether the surgery is needed or not. It is not merely by the ultrasound study which shows a cystocele require a surgery. So that point you should know. And the other point is, who are considered sexually active. Any person who is having intercourse once in 3 months is considered to be sexually active. Your duty as a gynecologist is to give due care to her sexual function. So I hope it helps. Thank you.